Good morning from WKYT News. I'm Bill Bryant, and we welcome you to Kentucky Newsmakers. A focus today on the deadly and destructive opioid crisis in Kentucky and around the nation. Former Governor Ernie Fletcher, who is a physician, will join us later to discuss an approach to the problem that he is heading up. But first, there was a congressional field hearing in Lexington this week to deal with that issue. It's pacing at more than 1,500 deaths a year in Kentucky alone. The CDC says a record 72,000 people died of drug overdoses this year. It's also costing people, their families, their jobs, and their standing in their communities. How do we get out of this very tough situation? Joining us are the chairman of a subcommittee who was here for that hearing this week, Representative Sean Duffy of Wisconsin, who also has an interesting bio. Congressman Duffy was a champion lumberjack who worked his way through law school and also appeared on MTV's The Real World. He was then a prosecutor before being elected to Congress. And the host for the field hearing, Central Kentucky Congressman Andy Barr. Barr is a Republican serving his third term in D.C., and if you've seen any TV lately, you know he is seeking a fourth term. Now, we'll have his opponent, Democrat Amy McGrath, with us soon here in Kentucky Newsmakers in a later edition. But today, our focus largely on this drug issue. And gentlemen, thanks for coming in. We appreciate it very much.
Good to be with you.
Let me ask you first, Chairman Duffy, welcome to Kentucky. We have this horrific problem with drugs in the state and nation, and this number that we got from the CDC this week, 72,000 overdose deaths. It's staggering.
It is staggering. And by the way, I'm here in Kentucky. Andy hosted us, put together a great panel today. I have a similar problem in my district up in central and northern Wisconsin. It's happening all across America, and we have to come together as legislators, figure out what are the best approaches to address this ravaging drug addiction that we have taking hold in our communities. Andy and I talked at our hearing today what it does to families and kids that have parents who have been hooked on these opioids. And we hear stories of parents who are strung out in their cars, and the kids are in the back seat, strapped in their car seats for hours as the parents are strung out. And what happens in homes where they parents who are strung out on drugs will dump cereal on the floor and food on the floor to let them eat for a few days as they're doing these drugs. This is horrific for our families and our communities. And it's Andy and I who are looking to our communities for what are the best solutions to help us address this problem.
When you have an event like this, and you did today, are you hearing anything that gives you any encouragement?
Well, if you want to go, Andy. I mean, yeah.
Well, absolutely. And I think, as Chairman Duffy pointed out, we go to our communities, the people who are on the front lines, to address this issue. Kentucky, like Wisconsin, has a serious problem with opioid addiction. Kentucky suffers from the third highest drug overdose mortality rate in the country. And nationwide, the Federal Reserve recently did a study. 1 in 5 Americans is going to be personally impacted by the opioid epidemic. Either someone in their own family, someone, a friend, someone they know. And so we're very gratified that this administration responded to members of Congress like Sean and myself when we went to them and we said we need a national response to this crisis. Last fall, President Trump declared a national public health emergency, and Congress has responded. The 21st Century Cures Act has brought over $20 million to Kentucky to combat opioid addiction, the Comprehensive Addiction and Recovery Act. And then this year, we passed a package of bills that includes legislation that I introduced that Chairman Duffy helped shepherd through the legislative process in our committee that will respond to the need for transitional housing for long-term addiction recovery.
Does any of that get at an issue like the second largest county in your district faces, Madison County? They have a jail built for 175 inmates. They regularly have 400 inmates, many sleeping on the floor. They don't have the money to expand. They don't have the money to have a long-term treatment facility, which they wanted to do. To get there, they were talking about having to cut the fire department from its stature where it is right now. Are there solutions for these communities that are being offered?
Yes, that's exactly what the hearing was about today. And many of these organizations, the Shepherd's House, the Chrysalis House here in Lexington, Recovery Kentucky, as you mentioned, Governor Fletcher was a pioneer in starting that when he was governor. These are organizations that are crying out for resources, federal resources, and Our legislation responds directly to that. It would provide a demonstration project for housing choice vouchers to be provided directly to these not-for-profit organizations for long-term transitional housing. Not just to give individuals some short-term medication-assisted treatment, but long-term sober living with job training, with access to employment resources, financial literacy, life skills, those wraparound services with the stability and the structure of transitional housing. That is, we know, an evidence-based solution for long-term recovery.
Go ahead, Chairman.
No, I was going to say it's important, like a bill like Andy's, is to recognize that we have tools in place that we can actually use if we inject some flexibility. And oftentimes the rules and regulations surrounding government programs are very inflexible. This kind of flexibility can provide resources to Kentucky and Wisconsin to let people on the ground make better choices, to use those resources to again have wraparound services, again providing housing for people who are in the recovery process. And I think we all recognize this is not what we've dealt with like alcoholism, which it's a challenging disease, but we've figured out how we can help people get through it. This is far different and far more challenging, and we're at the forefront of figuring out the resources that are necessary to help our communities address the addiction.
The other side of this coin, though, is with the competing different approaches, and so that you're not throwing money at a problem that is not working. As the federal government makes its decisions about where to place tax dollars, what are you looking for in terms of signals of success?
Well, what Andy's done is this is a demonstration project. So I don't think you say, listen, there's one solution, let's put all our money into it. To say, hey, there's a number of different really good ideas that we should try out and see which ones work the best, how we stretch our dollar the furthest, which, we have, 1.2 million housing vouchers in America. This is just 10,000 that we're going to use in regard to this opioid issue that Chairman Barr is addressing. So it's being smart about finding out what programs actually work through demonstration programs like this.
And the bill, the legislation that we passed out of the House, the Transitional Housing for Recovery in Viable Environments Act, or the THRIVE Act as I call it, the bill includes metrics of success. We're going to measure whether this works or how it works. We think it will, because as HUD Secretary Ben Carson witnessed, we invited him, actually, Chairman Duffy and I invited Ben Carson, the new Secretary of HUD, to come have breakfast with us when he was first confirmed. And we talked about this, and at that breakfast I invited him to come to Central Kentucky, to tour the Hope Center, to tour Recovery Kentucky, and to meet some of these wonderful organizations in our area, the Revive Lifehouse, the St. James Place, Shepherd's House, Chrysalis House, and learn about these models of recovery that are working. And the feedback from that visit was, from the Secretary, I need flexibility. HUD needs flexibility. We can't have this cookie-cutter, one-size-fits-all, top-down approach from Washington. Allow us flexibility to provide support directly to these not-for-profits, these faith-based organizations. And embedded in the legislation is a requirement that there's reporting, so that we know whether or not these programs are graduating people from the program into long-term sobriety, whether or not they're escaping poverty, whether or not they are able to sustain consistent job over time. And we will be getting that data back to measure our success.
Some say we don't talk about this problem enough, that it is,
right,
despite the fact that it's in our face every day, it's also to some extent on the back burner in terms of priorities for people, especially if they're not directly involved.
I think it's a good point, and that's why I'm grateful you're doing a show today on this important topic. While we're doing a field hearing in Kentucky, we've done the same in Wisconsin, but it's making sure the community understands what's happening with opioid abuse and how challenging it is for us to address it. And it's going to be a full community solution to actually get our hands around the problem. And I just one other point I'd like to make is the opioid abuse doesn't just affect Republicans or Democrats. It's affecting America as a whole. And what you've seen with Andy's bill and many of these bills, these are bipartisan bills. At a time that people don't see bipartisanship in Washington, you see Republicans and Democrats trying to come together to go, what are the best ideas? I don't care what party they come from. What's the best idea to help the most people? And let's rally around those ideas. And that's why you've seen a lot of bipartisanship in regard to Andy's bill and all these other bills. because it's an American solution, not a party solution.
We had a report this week that some schools are having difficulty finding enough drivers who can pass a drug screening. I mean, this trickles down in so many ways. But we can find the problem, we can identify the issues, but the solutions just seem very elusive.
Definitely, and we agree that there's not one solution here. We need a comprehensive solution. Some of it also has to do with our prescribing practices and making sure our physicians with pain management are avoiding narcotics when narcotics are not necessarily required. We're working with a group of anesthesiologists here in Kentucky on enhanced recovery after surgery, narcotics avoidance to prevent people from getting addicted. It's also law enforcement. There's a component. I introduced an amendment to our appropriations bill that passed thanks to Congressman Duffy's support. We passed an amendment that increased funding for the high-intensity drug trafficking area program, $26 million more to bring more federal law enforcement into the 6th Congressional District of Kentucky to help keep these poisons out of our communities. It's about border security. We need to protect our southern border. The Customs and Border Protection Agency is reporting that 80% of the interdicted heroin into this country comes across the southwest border. And I was in the Oval Office with a bipartisan group of members of Congress who voted for the Interdict Act, which gives the Customs and Border Patrol Agency more resources to detect the importation of fentanyl, which is a very deadly synthetic opioid. So it's not a one solution is the answer. We know that this is a very comprehensive problem, and we have to go at it in many different areas.
Okay, and part of the problem too is education. We got to make sure our kids understand how devastating these drugs are and how quickly they can become addicted to them, and push them away from some really bad choices.
To the earlier point, have things worked though, like the war on drugs? There are questions about the effectiveness of some programs that have been tried, the DARE programs and so forth. I mean, is it a continuous auditing of these programs to see if they work that it also needs to be examined?
Well, I think when we don't pay attention to drug abuse, you can see an epidemic spring up like this, where all of a sudden we're now behind the ball trying to go, what do we do to prevent this? Where at least when we're talking about drugs and drug abuse with our kids in our schools, I don't know if that's the right approach, but we know that they have powerful information to make the best choices for them in their lives, as opposed to sliding into, taking an opportunity to use drugs that could devastate
at least
their
to have
future.
the conversation. All right, we're coming back in just a moment. Representative Andy Barr and Representative Sean Duffy are with us. We're talking about a field hearing that was held this week on opioids in the Bluegrass. Welcome back to WKYT's Kentucky Newsmakers, and earlier this week there was a field hearing in Lexington about the awful problem with opioid overdoses and deaths, the whole issue in America, 72,000 fatalities. Representative Andy Barr of the 6th District in Kentucky, Representative Sean Duffy from Wisconsin are here. We've been discussing that. One of the interesting things, and we're short on time here, but the workforce development issue, the fact that companies are having trouble finding people in a good economy, they're still having issues finding enough people to fill these jobs. Yeah,
I mean, what employers in central Kentucky are telling me and around the country is that the economy is booming. We have more job openings than people who are unemployed, and that's a positive thing. But every HR manager, plant manager, farmer in central and eastern Kentucky tells me regularly that they can't find workers who can pass a drug test. And so this is not only negatively impacting and destroying lives, and we're losing loved ones as a result of this. It's also a cold, wet blanket over what is otherwise a booming economy. So if there is one real problem with our economy, it's labor. It's the lack of labor supply. This is not the only issue that we need to deal with, but certainly if we can tackle the opioid epidemic in this country, we can make this economy even stronger because people will be moving back into the workforce. It's really a good thing because we want these people to have a second chance.
Does the government do the training? Or is it?
We can be part of it, yeah. And we just heard testimony today that in some of the recovery houses, they will actually, place their residents in jobs and then drug test them, so you don't have someone who is high on drugs going into the workforce and creating a safety issue on the job. I want to also be clear that when we say, the individuals are drug tested and can't work if they're doing drugs, that doesn't come from me and Andy or from your state government. That comes from insurance companies that say, we're not going to insure you if you have people doing some dangerous work and doing drugs. And that's what we have to figure out, is how do we then place these folks who are in the recovery mode into jobs that the companies can still get insurance but still employ individuals. And by the way, it builds self-esteem. It builds self-worth, which is an important component of getting people off the drugs.
If people still want to be heard, is there a way that they can add their comments to your hearings or to the public discourse on this?
Absolutely. They can obviously contact our office and submit testimony, but I would encourage any constituent in my congressional district to join the 6th District Drug Abuse Task Force. We've got wonderful constituent organizations that have, for several years now, submitted legislative ideas to our office, many of which have been incorporated in some of these federal bills.
Congressman, your race for re-election has gotten tough in a hurry. The rough ads are already out there. Are you concerned where this campaign is going to go between you and the Democratic nominee Amy McGrath before November?
Well, it is true. The country is divided. But the real point of our campaign is that we're getting results. We don't want to go backwards. We want to go forwards. And the country is doing better.
But just
People are better.
The messaging. I mean, couldn't you stand in front of a flag and say what you're for?
Absolutely. And that's what this campaign is about. And we communicate in a lot of different ways. But it's also a choice. Campaigns are about choices. And it's important to know that ideas matter. And there are very big differences between the ideas of my opponent and my ideas, but more importantly, we've gotten results. This legislation is a good example of that, fighting and having success in combating the opioid epidemic and moving an economy forward with a booming economy, an agenda of tax cuts, deregulation. We are delivering results as a result.
Gentlemen, thanks for coming today. We appreciate it.
Thank you, Bill.
We'll be back with former Kentucky Governor Ernie Fletcher. He weighs in on that issue coming up. We welcome you back to Kentucky Newsmakers, and we're delighted and honored to be joined by former Kentucky Governor Ernie Fletcher. It's been a while. Governor Fletcher led the Commonwealth from 2003 to 2007. He served in Congress and in the state legislature before that. Dr. Fletcher is also a physician whose career in medicine led him back to public service. He was a military pilot even before all of that. Now Governor Fletcher is the founder of Recovery Kentucky and another national effort, and we want to learn more about that. We also just want to catch up some. It's good to see you. Thank you, Governor.
Bill, it's very good to be here again. Thanks.
It's like old times.
Yeah, it is.
It's been a while. We
appreciate.
You appeared many times while you were a governor and congressman, and we always appreciated that.
Well, thank you. It was always a privilege, and we're anyway very hospitable. We enjoyed the opportunity to talk to the folks in Kentucky through this medium.
It's been 11 years, really,
since you
over
left 10 years since I left office.
What have you been up to?
Well, I was, as a physician, I was back working in healthcare. We had a company with healthcare IT. We managed practices. We eventually worked with Emory University healthcare system and did a lot of practice management. We have some health and well-being clinics we ran down in Atlanta. We still have one of those, and now we're in looking back at addiction and lifestyle disease.
Mm-hmm. Do you still put on the stethoscope occasionally, or are you now more
I do. I
administrative?
still. I had to cancel this Friday's clinic in order to be up here, but I don't. It's not full time, but I still keep my hand in it and stay board certified, so that I can keep up to date with what's going on.
Still talk to so many people who say, they remember you as governor and congressman, but you were a good doctor.
Well, they usually say I was a better doctor than politician, Bill. So maybe I'm back where I belong.
So you spend a lot of time in Atlanta. I'm sure Kentucky is still home, right?
Kentucky's still home, and Glenn and I keep saying we want to get back there. Our business is down there, but we come up here regularly, and we know so many people. It's a no place like Lexington. Great place.
Let's talk about what brought you in for this trip. This opioid problem is, as you know, just crippling the state. It has gotten much worse over the years since the time when you were governor, and certainly when you were practicing medicine. What's going on?
We see the consequences of it. I mean, every family is affected by it, Bill. Just talking, the recent numbers came out, 74,000 people a year are dying of overdose, and 80% of those thereabouts are due to opioids. I don't think we have all the real answers of why we're a vulnerable society, and I think we need to do a lot more research on that. But clearly the prescriptive practices of physicians have led a lot to that. If you've ever read Dreamland in that book, it kind of goes through what happened. But what we're seeing now is a real strong effort out of Congress, and I'm appreciative Andy Barr is holding a hearing down here on that, financial services for housing. And it relates to what we're doing in Recovery Kentucky.
And tell us about that program, Recovery Kentucky, and then there's a national effort that is underway as well that you're leading.
Yes, back when I was governor, I appointed Don Ball as chairman of the Kentucky Housing Corporation. He had worked with the Hope Center here in Lexington that was designed after the Healing Place in Louisville, which is a residential recovery center for folks with addiction. And it's whether they're addicted to alcohol, other drugs, or opioids, it's a place where we found that in a residential setting, a very disciplined, it's called peer support, follows the 12-step. We got some very good results of turning people's lives around and transforming them. So Don came with some very creative way of funding these centers through HUD and housing and low-income house tax credits and Section 8. And then we worked with corrections because a lot of folks that are involved in the criminal justice system are there due to addiction. And many of them are not violent offenders. They're folks that have been really held captive by addiction. So he established this program. We had a funding that makes it sustainable. We now have 18 centers. We have over 2,100 beds. I met with Don anyway, over the last several years. I've worked with Don. Fortunately, recently passed away, but his vision was to take this nationally. So he asked me to help him. Then as he got ill, he said, Ernie, you need to lead it. So, Don is a very persuasive, and really it's a passion we've had. So we're taking this nationally, using the model we have here in Kentucky, which has proven very, very effective.
What makes the key difference in recovery for those who are addicted?
I think the biggest thing is that I think peer support and having them in a controlled, disciplined environment. It's around the 12-step. It has not only teaches them life skill and responsibility, but they have a lot of support there. It also gives them meaning and purpose in life. It has a spiritual component, so it's very holistic. And it doesn't work for everyone, but we have, through the University of Kentucky Drug and Alcohol Research Center, a survey that's done, and about 84% of people remain drug-free at 1 year. So the numbers are very good. There's other ways, obviously, of treating, but this is one way we found effective and really turns lives around.
When you talk of cause and effect, and again, you were and are a practicing physician, and when you look at the ways that we eventually came to track those who were shopping doctors and this better, everybody thought, things will get better and quickly. And they haven't, and the overdose situation is horrific in our state.
It is, and a lot of it's due to this demand that we had out there for opioids ended up opening up a market that came out of Mexico with this black tar heroin. And now that's cheaper than prescription drugs on the streets, and very available. And then you get a lot of, they're lacing that with fentanyl, which is 100 times plus more potent. And you end up folks injecting things that are much more potent than what they realize, and it results in death. So it was this, a lot of it was the pill mills, and a lot of that's been taken care of. Physicians were over-prescribing opioids for pain, and then some were just doing it as a pill mill and a way of making money. Unfortunately, that occurred, but now we see that folks have transitioned to buying stuff on the street. And I was recently with Dr. Vocal out of NIDA, the National Institute of Drug Addiction, and she said that what we're seeing too is that when we're stopping some of the opioid and reducing that through managing prescriptions, we're seeing folks switching back to methamphetamine and other things. So it's a complex problem, and it's going to require a complex and a really a broad spectrum, holistic approach to this problem.
And if you can be supportive as a society in helping get the job skills, get the transitional housing, get folks to a point where they can then go on with their lives again, does that make it much less likely that they will slide back to those problems.
It does. You're still going to have some relapse because this craving just is very difficult. There's something called medication-assisted treatment that is also being used, and it's really the evidence base from out of the medical community, and that can help with that craving too. So some people are better treated with that, let me say, and that's why I say it's not one size doesn't fit all, but giving them a purpose. And then we, over 75% of our folks that come out of the programs have a job. We're working on improving the skill training of these individuals so they can enter a higher level job, one with a living wage. Also, transitional housing and those things make it easy so people can get kind of re-enter society. But if you don't have those things in place, the relapse rate, as you just mentioned, is much higher.
You talk about purpose. You seem to have found one here that is certainly keeping you working. I mean, you enjoying life these days?
I am. This is, I guess if you see my life, it's gone in phases, Bill. I guess this is a phase. I don't know if it's the last one or not, but it's exciting because when you go to these centers, and I invite you to come and do a tour of one. You may have already done that, but when you hear the testimony of these people whose life was totally wrecked by addiction and it's turned around, they've got a kind of a new purpose in life and they're transformed. Many of them say these are the best years of my life. It's exciting, and we get very passionate about that as we see what we can do. And certainly the need is out there. It's not something, unfortunately, that's going to go away immediately, but I do think there's a lot of effort being done that's going to help turn some lives around and save them out of this terrible scourge of addiction that we have.
We appreciate you coming by, really do.
Bill, it's great to be back and good to see you.
And give our best to the former First Lady Glenna. She certainly filled that role elegantly and quite well.
Well, thank you. I'll pass that along, and she's co-chairing our efforts, so she's very involved as a nurse as well. So I'll pass that along. Thanks,
we appreciate
Bill.
it. Thank you. Thank you for joining us for this edition of Kentucky Newsmakers on WKYT. We'll see you bright and early on WKYT this morning, and you make it a good week ahead.